Dog limping back legs, causes and symptoms. I'm Isabella, an accredited veterinarian, and today I'll explain you the most common reasons why dogs limp on the back leg, the symptoms you should watch for, and the basic anatomy behind this injury so you can understand better what may be happening to your dog. Dog back leg anatomy made simple. Your dog back leg contains several major joints: the hip, the knee, also called stifle, and the ankle called the hog. These joints are supported by bones, ligaments, tendons, and muscles. Inside the knee is also the cranial cruciate ligament, also called the CCL. Many owners also know it as the ACL because it performs a similar stabilizing function. When any part of these systems becomes painful, weak, or unstable, your dog may limp to reduce the pressure on the affected leg. Dog limping from a paw or nail injury. Before assuming the problem is inside the knee or the hip, first examine your dog's paw. A torn nail, a cut pad, a thorn, a small piece of glass, or also irritation between the toes can cause sudden limping. Your dog may lick the paw repeatedly, hold it off the ground, or react when a specific toe or pad is being touched. Check carefully, but never force the leg into an uncomfortable position. Dog limping from a muscle strain or a sprain. Dogs can also strain muscles or mildly injure soft tissues after running, jumping, sleeping, or also playing intensively. The limp may appear suddenly after the activity, but improve with the rest. You may notice stiffness, sensitivity, or reluctance to run and jump. A mild strain can resemble into a more serious injury. A persistent or worsening limping still requires a veterinary examination. Dog limping from a CCL or ACL injury. A cranial cruciate ligament injury is one of the most important causes of back leg limping. The ligament normally prevents abnormal movements between the femur and the tibia. When it becomes partially or completely torn, the knee loses stability. Common symptoms include sudden limping, difficult bearing weight, swelling around the knee, trouble standing up, or reluctance to use stairs. Some dogs only touch their toes lightly to the ground. With a partial tear, the limping may temporarily improve and then return after exercise. So, can a dog knee brace help dog hind leg limp? For selected dogs with knee pain, CCL injuries, arthritis, or joint instability, the hinged dog knee brace can be a practical way to provide additional support during controlled movement. Its adjustable hinges are designed to stabilize the knee while still allowing the leg to blend naturally when the dog walks, sits, or lays down. Some dogs may need structured support and rehabilitation rather than immediate surgery, particularly when the surgery is not recommended because of its age, health, injury, or recovery circumstances. A properly fitted hinged brace from companies like Tailwind Pet can help the dog feel more stable, remain mobile, and place weight on the affected leg more comfortable. It is a feasible option worth discussion with your veterinarian as part of an individualized recovery plan. A brace supports the joint but does not reconnect a completely torn ligament. Correct sizing, gradual introduction, controlled activity, and regular skin checks remain essential. Dog limping from a luxating patella. A luxating patella occurs when the kneecap moves out of its normal groove. It is especially common in smaller dogs. A typical symptom is intermittent skipping. Your dog may suddenly lift the leg for several steps and then begin walking normally again when the kneecap returns to its position. Repeated episodes should be assessed because the condition can worsen and contribute to joint damage. Dog limping from arthritis or hip problems. Older dogs commonly develop osteoarthritis, which can cause stiffness, reduced mobility, and limping that is worse after resting. Hip dysplasia can also produce back leg discomfort, difficulty climbing stairs, reduced willingness to jump, and a swaying or bunny hopping gait. Because dogs often compensate for pain in other joints, the location of the limp does not always reveal the true source of the problem. Now, how to know when dog limping is an emergency? Seek urgent veterinary care if your dog cannot bear any weight, cries in pain, has major swelling, shows an obvious deformity, drags the leg, or becomes lame after a fall or collision. You should also arrange an examination if the limp persists, repeatedly return, or becomes worse. Your veterinarian may perform an orthopedic examination and recommend x-rays or additional testing to identify the cause. Finally, it is important to note that dog limping should never be diagnosed from one symptom. Back leg limping can originate in the paw, muscle, knee, hip, or even in the spine or nervous system. Early diagnosis matters because continuing normal activity on an unstable leg or painful may worsen the injury.